Hello, I am Tu Kim Lam. Welcome to the Medical News Show from Washington, D.C. In the last edition of Medical News, we talk about causes, symptoms, or the risk factors and methods of diagnosis of heart attack. Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will share with us about the new medication and treatment for heart attack. Welcome to our Medical News Show, Dr. Tran.
Yes, hello everybody, and hello Mrs. Lam.
Dr. Tran, today we're going to continue our conversation on the heart attack disease. First of all, can you review briefly what are the underlying causes of heart attack?
Yes, I think it's very important that we need to know the underlying causes of heart attack before talking about treatment. The underlying causes is, if you look at the pictures on the screen, you can see there's some blockage of one of the arteries of the heart, causing by the cholesterol. And the blockage caused by the cholesterol release is not exactly the cause of the heart attack. And if you look at the second pictures, if you see different degrees of the blockage of the artery of the heart, from nothing to 25% to 50% and 75%. Now, what happened to the surface of the cholesterol black? And when something ruptures in a tiny break of that layers, the body recognizes that right away, because they have the system that recognizes any bleeding, any ruptures inside the body or outside the body. And the platelets is very important. Platelets play a key role to fix that area by forming a clot to block that area of leaking. When they doing that, it's really platelets causing the clot. We can see in the pictures at the bottom part, and the red one is the clot. When the clot forming, they will block completely the artery and shut down the circulation of the arteries of the heart and causing heart attack. So remember, platelets is the key, cholesterol causing blockade, but the platelet and ruptures the black causing heart attack.
So let's talk about the treatment of heart attack. Can you share with us how many type of treatments are there available?
If we know exactly the cause, just most of the experts and the specialists try to target the area of the clot by using medication to break the clots. We call thrombolytic therapy. Thrombo means thrombus is clot. Lytics mean try to break the clots. That's very useful kind of treatment we use for almost about 20 years now with different medication. And then recently we're talking a lot about the open up the arteries by using the catheters and the balloon they call angioplasty with balloon or stent we're going to talk about. And finally we use surgery for severe cases.
As you mentioned above, there are three ways to treat the heart attack disease. First of all is medication. Can you tell a little bit about how the medication works in order to break the blood clot?
Yeah, the medication releases have a special chemicals that can break the clots. And the first medication we use streptokinase. And we don't use anymore because we have new medication with less side effect and able to use it. Second medication is called the antiplatelets, and aspirin is the first one, because aspirin can block or inhibit the function of platelets. Remember, the platelets is forming the clot to fix the area. When we use aspirin nowadays, the recommendation is when you're concerned about heart attack, go ahead and give the patient one aspirin before any other medication. And we also have another new one called Flavix. The same thing with the aspirin, but we're able to use for people with stomach problem.
So very often the patient was advised in order to take blood thinner medication. Can you tell us the differences between the blood thinner medication and the medication that break the clot in the artery?
Yes, there's definitely a difference between the two medications. The first one is thrombolytic, means just to break the clot. The second one is the blood thinner. When we break the clot, we try to maintain the blood thin enough to prevent the clot to reform. And we have medications we use for a long time called heparin, but they have to give by intravenously. And we have to monitor the blood thinners very closely, because if the blood so thin, it may trigger some bleeding somewhere else, like in the brain. Recently, we have the new medication Levanox, and we can use given subcutaneously, and then patient can go home and take care of that by giving themselves a shot. And the most commonly used medication used nowadays, Coumadin, is blood thinner, or warfarin. People take orally and monitor the blood thin every month or so, and to keep the blood thinning up to prevent the clot to form in the area. And Coumadin also was used in other purposes as well.
So can you tell us, are there any new medication on the market right now for the physician to order?
Yes, so I think recently we have numbers of medication that you can see on the screen, and but mainly they use to, again, the platelets, or decrease the function of platelets, or stop the action of platelet. And we have the new medication just come out about years ago called Afgen. Afgen is working like aspirin, but it's stronger, and using specifically for the heart attack only, or after they do the open up the artery, or given the medication to break the thrombus.
So let's talk about the surgery procedure that open up the blockage. How does that perform, sir?
To open up the arteries, and we call angioplasty, or balloon, or put a stent. Very important that first you look at the area of the blockage, if you look at the screen, and then in order to open up the area of narrowing, you can see on the left side of the screen, you can see a small catheter will insert to the area of the narrowing. And then on the other side, you can see a balloon, look like it's able to inflate and deflate. And then the another picture you see right in the middle, you see the balloon. And then the balloon also carry another net-like structures and called stent. And the stent will stay inside the artery to keep the arteries open or patent. So that's basically the principle how to open up the artery. Now, the real procedures, if you look at on the short movie, you can see how they able to do it. First, they look at the artery, looking for the area of the narrowing, and then by inserting this small tiny guide wire, go to the area, looking for the area of narrowing, and following that, they insert another catheter along with the guide wire, and then from there, the tip, you can see the balloon carry the stent. So they will inflate the balloon to open up the area of narrowing, and then they deflate the balloon to withdraw the balloon to leave the stent in place. So that's basically the procedures, and as will be done, the patient able to be awake and watching the movie as well. And I think it's very successful nowadays with that kind of technology. A lot of people have stent in place in their body.
So as you described, once the insert the stent, which is open up the blockage, and the blood will flow very freely. So that way the patient is okay, but there are many cases the doctor order for surgery. Can you tell us why does the patient need surgery once it's stent open up, or does that case apply for everyone? And that one question. Another question is how does surgery perform?
Well, basically, since the angioplasty or open up the narrowing of the arteries only apply for the facility have the doctor have the kind of skill, and also need to be in the hospital for the first 6 hours. And all the equipment available, when they rush the patient to the hospital, they have to go to the area that they're able to do it as well. Secondly, is when the patient has more than 3 arteries have the severe blockage, they cannot do all of them because the risk of break the arteries is higher. Therefore, they have to rely on surgery. And lastly, some patients and number of patients come to the hospital very late because they didn't already know they have heart attack. When they come late, they have the kind of failures of the heart pump, and they have the damage of the valves of the heart. Therefore, they have to go to surgery to fix all of these, fix the arteries and fix the valves and fix the area of damage. So surgery is very important. There's large resources to deal with the severe case of heart attack.
Can you describe how the procedure is done, sir?
Yes, the procedure is quite complicated, but to make it simple, if you look at the screen, you can see the area of the arrow. You can see some of the area of the blockage of the artery. And when they try to bypass that area, I mean they had to rely on some kind of vein or artery. They borrow from the other place of the body. If you look at the second pictures, you can see they remove one of the vein of the leg and use that part of the vein to connecting from the normal artery to the area bypass the blockage. So that's called bypass surgery. If they don't have enough veins, then they can use artery inside the chest, and to do it like you see on the pictures in the small tiny red vessels there to connecting from normal to the area they bypass the blockage. That's basically the principle of using what we call bypass graft surgery.
Sir, a lot of time when the patient was preferred for surgery, and many of them really worry and have worry about the surgery complication. First of all, can you tell us what are the complications of the surgery? And if the patient chose not to have the surgery, what would happen to them?
Well, basically, surgeries really have the risk by itself. From the time of the start of surgery, from anesthesia to the complication during surgery as well, because the blood loss, and also complication after the surgery like infections and failing of the heart pumps and some severe pain and need some time to recovering from the surgery. But the good news is, because with the technology, with the knowledge about the heart attack and the skill of the surgeon, nowadays people usually go through the surgery very successfully, and usually they stay in hospital for 5 days or 7 days before they can go home and recoveries from the surgery. And I think the mortality is very low in the different institutions around the country. So I think that's the good things about the surgery nowadays, because so they give the patient more confidence to make the decision if they have to go through this surgery.
So what if they chose not to go
If
through
they
the surgery?
choose not, I think I saw a number of people choose not to go to surgery. They still using the medical treatment, but they have to maximize on the treatment. But the risk is they still develop a heart attack anytime. And sooner or later, when the artery is completely blocked, they will go to the failing or heart failure, because the pumping is weaker and weaker because they don't have enough blood supply to the muscles. So they still have a risk. They may be the same risk like with surgery. But with surgery, people may live longer and the better outcome. They feel much better after surgery.
Sir, before wrapping up for the medical news today, can you share with our audience some of your thoughts on the treatment for heart attack nowadays?
Well, the treatment of heart attack is have a lot of good things nowadays, because the technology, the knowledge, and how to care the patient after surgery as well. So I think it's with the medication, the balloon or stent, and the technologies and simplify the surgery, I think we have very good outcome, and we're able to decrease mortality. But it's very important. The preventive medicine is so important. You need to be aware of how you develop heart attack, what the symptoms look like, how to rush to the hospital as soon as possible in about 6 hours, and take care of the cholesterol. And I think stop smoking, exercise, and I think that's the best advice for all of you listen to the program today.
Thank you, sir. Thank you for being with us today, sir.
Thank you for watching our medical news today, and again, thanks, Mrs. Lam, for.
Thank you. That was Dr. Tran, who just shared with us the new medication and treatment for heart attack. We hope the information that Dr. Tran has provided to us today has shed more light on the heart attack disease. That is all the time we have for this edition of Medical News. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the Medical News. Until then, have a great one.